Hello, I'm Lieutenant Colonel Jen Cowie from Headquarters Air Force Services, and it is my honor to be here today to provide you an update from your questions and feedback from the EFMP 2020 Summit. We were so thankful for everything that you provided us, both in our email inbox and through a direct message to this page. We certainly hope that you were able to provide and express your concerns and questions that you had within the program, and we look forward to our continued partnership with you. It is my honor to introduce to you Ms. Tammy Nelson, our lead change agent for EFMP.
Hello, it's good to see all of you again. I'm looking forward to updating you on everything we've done on EFMP since we last talked. So remember last time we talked, I said we were going to do a respite care rapid improvement event. We've now completed that. We had a great event, a lot of people participated, and I think we've got a good plan going forward to at least start to improve our respite care program. Last time we talked about DMAIC, using define, measure, analyze, improve, and control. A true process to look at what are our problems. So we defined the problem, and actually you defined the problem for us. All your feedback was used, and we said, okay, we get it. We've got a problem, and we used your feedback as our problem definition. And then we do measure, where we talk about some of the numbers involved and some of what's happening, sometimes customer satisfaction, those kinds of things. This time we did something a little different. We also did some benchmarking. So the Army, Navy, and Marines also came in, and they told us about their program. So that was also very useful to understand what they did. Then we write out our process as it exists today. And we look at all the problems that we believe are in that process. We had a pretty extensive list. But they group into three major categories: policy, approval of providers, and communication. So I'm going to spend just a little bit of time on each one of those. Policy. Pretty easy. We don't have one. So it's difficult to ask you to follow a policy that's never been written. Things like, what's the difference between respite care and child care? We don't have a policy defining that. So that's going to be one of those things we spend quite a bit of time working on here in the next few weeks and months. We also need a rubric. We want a rubric that classifies our respite care needs, mostly because we want those with the highest need to really get the access. And we want to make sure those that have the most need are getting the access they need. So look forward to seeing some things on policy here in the not too distant future. Provider approval. You've given us a lot of information on how difficult it is to get providers approved. We understand. So we're looking at all the requirements for a provider. And are they the right requirements? We're going to study that. We're going to make sure we're asking for the right things. Obviously, this person's coming into your home. We want to make sure we've done the work to make sure your family's going to be safe. But are we getting too far and going too far? So we're going to study that. We'll keep you informed. But please continue to give us provider recommendations. We're going to work on that process to streamline that process better as we work on the requirements. But please continue to give us recommendations. The one thing that could help is if the provider sends a complete package. Many of the things we looked at is we're missing a resume, or we're missing the physical, or we're missing one piece, which keeps us from being able to approve the provider today. So if you can make sure when we get the recommendation, tell your provider the best thing you can do is send a complete package when they send it in. That would be great. And then communication. Without a policy, it's hard to communicate the rules. We're going to do a lot of communication once we get more of this defined. So early next year, I expect to be doing another big update for you on respite care. This is the beginning of our respite care journey. We're going to get policy, we're going to look at providers, we're going to continue to do some benchmarking, and then we're going to do another event. So we're going to continue to improve, and I assure you we've heard you on respite care. A couple more updates. Command screening list. Remember I told you last month that we were looking at the command screening list to test our new EFMP process. And the biggest part of our EFMP travel screening process that we wanted to test was the use of insurance claims rather than having you go schedule a whole bunch of doctor appointments. So we're into that test. We're learning a lot. Again, communication seems to be our biggest struggle. When you work with your SNC on base, I'm not sure all the SNCs always know what we're trying to do with the test, and we're still working our way through that. But the good news is it's going pretty well. We have yet to ask anybody to schedule a doctor appointment, so we're still early. We've approved probably a dozen or so cases so far, but no one has had to go schedule a doctor appointment, so that part of the test is going well, and we'll keep you informed. Right now, I consider it a successful test so far because if everything went well, I don't believe we would have found everything. Knowing that we're finding some things says we've got some things to fix. So all good so far. We'll keep you informed. The biggest lesson learned that you can help us with is submitting paperwork in a timely manner. So from the time our cell receives the paperwork to the time they're getting families approved with a travel recommend is actually less than 2 weeks right now. So if you think about that, if you can get the paperwork to us within a week or two of getting your assignment notification, you can be approved very quickly right now. So keep that in mind when filling out the paperwork. I get it's a lot, but that's what we're going to need to clear. So the more the better for us. One other thing on the travel screening, our new travel screening system that we showed you the demo on, that runs on Google Chrome. Unfortunately, Cubase, which is the next step in the EFMP process, will not run on Google Chrome, and you have to use Internet Explorer. So you have to use Chrome or something else for MyVector. You can't use that for Cubase. So we're working to fix that. The fix won't be in until after the first of the year, though, so just stick with us on that if you would, please. We're really excited about our new My Family Vector dashboard coming. Remember I told you about the provider dashboard? And the provider dashboard lets you log in and see, based on my family needs, which bases have a history of being travel recommend or not travel recommend. So it gives you some idea, just directionally correct, but if it's 100% of the time it's travel not recommend, at least you would have some idea that it's not likely to get recommended for that base. And at the time, we showed it to you, but it was CAC enabled. Our new website is truly days away from launching. Please stay tuned and look for that. It's going to be called DAF Family Vector. So it's Department of the Air Force Family Vector, and you should be seeing that soon. Your feedback is really important to us on everything, but especially on this, because tell us what you want to see on that website. We've made it so we can continue to build on it. At initial offering, we'll see what's on there. I know the provider dashboard's going to be on there. We'll look and see what else we can add, but please let us know. What kinds of things would you like to see? What kind of information can we continue to get to you? And again, from the last summit, we've answered all the questions we think. So if you haven't gotten an answer or if you're not happy with your answer, please reach out to us again and continue to let us know how we're doing. So we're continuing to work on it. I look forward to our next update, but keep the questions coming. Thanks again.
Thank you, Ms. Nelson. Next, we will hear from Ms. Tami Hern, the Division Chief for our Exceptional Assignments Programs Division.
Good afternoon. My name is Tammy Hern, the Chief of the Exceptional Assignments Program Division and home of the EFMP cell. Today, I'd like to spend a few minutes to get you updated on how things are moving along with the EAP Division. We spoke briefly during the virtual summit in October. Now I get an opportunity to pass along how things are coming. The new construct on this chart reflects the integrated cells end state. Of note, the assignment and medical teams will work side by side, coordinating assignments and family member travel clearance for our EFMP families. Our physicians and several medical support team members are on staff. We now have our permanent medical technicians on assignment to join the EFMP cell. They will join us in the January-February timeframe. You will also notice we are adding several support agency liaisons to the team. Respite care, TRICARE managed care support, a special education specialist, and an attorney steeped in special education law. These critical team members will advocate for comprehensive and standardized care for exceptional family members, as well as provide training and assistance to our base level program partners. The respite care position. Ms. Nelson provided an update on the Respite Care RIE, the means to make this program work better for our EFMP families. We used that week to help shape this position, to outline the duties and responsibilities so that this liaison may be able to help our base level partners bring this program to life. Our TRICARE Managed Care Support Liaison will work closely with TRICARE leaders to ensure care availability information is current and accurate. The Special Education Specialist and Attorney. The Air Force is committed to offering legal assistance and specialized education consultation to families who encounter difficulties obtaining and maintaining special education services. As a matter of fact, it was one of the most significant concerns reported during the October virtual summit. We continue to address ways to assist you. We are training our base level attorneys, school liaisons, and family support coordinators, as well as offering courses to better equip our families with ways to advocate for educational services. We scheduled a series of specialized training of military parents, also known as STOMP, workshops over the next year to help parents learn about the educational rights for children with disabilities. The first workshop was conducted virtually the weekend of 14 through 15 November. We had 100 slots available with 50 families participating. We highly encourage all families needing assistance with special education or IEPs to attend this workshop. Our next workshop is in early 2021, and you can find out more information on the workshop from your local EFMP Family Support Coordinator, and we'll also keep updated information on our Facebook page so you can plan to attend. A few other updates for the division build. We have our assignment navigators in place to assist EFMP families with assignment challenges, as well as an advertisement for the Assignments and Family Support Branch Chief position out now. This team exists to ensure that EFMP families receive the support they need. Families will continue to receive care from base level agencies, those experts you can turn to on your installation. Our staff of support liaisons are united at the headquarters staff, jointly interpreting laws and providing policy and guidance to base agencies, advocating for program support and resources, and collaborating to provide a streamlined, efficient EFMP process for you, our families. We also serve as a lifeline when you need it, a place you can call if you feel stuck in the process. We'll help navigate through the issue and provide a warm handoff to the agency representative who will assist you. We truly appreciate your continued feedback and welcome your ideas.
Thank you, Ms. Hern, for the update on where we are with staffing our EAP cell. As many of you know, we really encourage and appreciate the feedback that you provided to us during our last summit, and we encourage you to continue with your submission of ideas and ways forward that would best serve you and your family members. To do so, we ask that you either send us a direct message here on this Facebook page or that you use our organizational inbox to send us a message with information so we can help you out. Should you want to submit a specific question for your case that includes personally identifiable information, we encourage you to please submit that through our organizational inbox so we can best protect you and your family members' information. Again, we appreciate your feedback and we are so very thankful for all that you do to support our EAP division and our way forward. On behalf of the EFMP staff and program folks here at AFPC and at Headquarters Air Force Services, we thank you for your continued partnership. We encourage you to stay safe and healthy, wearing your mask, washing your hands, and socially distancing, and we wish you a happy and healthy holiday season. Thank you.